What is the definition of depression?
So first we have to realize there is such a thing called clinical depression because many people believe the word depression is equivalent to sadness. And there is a big difference. Sadness is experienced by all. We have moments of sadness when things don't go our way or we lost something. When a child is upset and they could be sad and crying. But depression is a short one word to indicate there may be a major depressive disorder. And then there are other terms, I'm not going to expand on that today. But clinical depression is a disorder when there is deep sadness lasting pretty much all day long, day after day, and it affects their function in life. And sometimes there's no particular reason to even cause that, or even the original cause to trigger that depressive illness has gone away and they're still depressed. So if somebody is feeling that way for 14 straight days, that's the actual number we start to ask about, then we start to wonder and suspect maybe there is a depressive disorder illness.
What could cause a child to be depressed?
Yes, this is a very good question. Long time ago, people thought children don't ever get depressed. And there was a misconception that only adults do because so many adults express how they are depressed and they stop working or they ruin their relationships because of it. But children do experience depression. I, as a child and adolescent psychiatrist, I meet them all the time, unfortunately. And this too also is multifactorial. And I will draw that for you. For example, there are biological factors, and that biological factors include genetics. There is a play in genetics. If they had a primary family member, like their mom or dad, grandparents, aunts or uncles, if they had depression or bipolar disorder, then there is a chance that that genetics can pass down to the next generation. Also, medical problems. Many different children, they experience medical problems, but commonly we always screen for thyroid issues and anemia and any other chronic illnesses. And also another biological issue are the neurotransmitters, a very fancy name for the chemicals in the mood center of the brain. For example, a main player is called serotonin, amongst others. So if that is not functioning well, that can affect the person's sensation of their emotion and make them feel depressed, even though there's no reason to be depressed. Psychological factors, for example, other psychological disorders can feed into and worsen depression. We reviewed a lecture on anxiety. Many times when an anxiety problem is not improving, that can lead someone to feeling depressed and they feed into each other. Fixed thinking, incorrect thinking, and fixated on that or obsessions. A lot of times these are psychological factors. Sometimes unresolved jealousy and envy, which usually comes from incorrect thinking, can cause that person to experience depression. Now, sociologically, we're talking about the environmental factors. For example, a traumatic event that can jumpstart someone being depressed, making them feel unworthy and unloved, or bullying, which is a type of trauma. Academic problems, because then they start to compare themselves with others, or they start to worry about their future is ruined if they don't get straight A's. Friendship conflicts. Children and teens beginning to develop pure relationships and healthy friendships, meaningful friendships are so important. But if they're being bullied or they're being left out, they can start feeling really down on themselves. And that could lead to problems of sadness and depression. And also, don't forget, continuous significant problems in the home, fighting amongst parents, domestic violence, or even alcohol problems in the caregivers, causing a lot of mood issues and behavioral problems, or even another sibling going through a lot of difficulties can bring a child's experience to be very unenjoyable and unpleasant at home. And then lastly, don't forget the spiritual aspect that causes depression. Now, spiritually, if you have met Jesus, you would understand that before you met Jesus, we were spiritual orphans. And we were actually belonging to a different family, right? And the Bible says if we receive Jesus and believe in him, we have the right to become children of God. The Bible also says we were once children of the devil. So, which family are you a part of? And if you are not a child of God and having this slavery under Satan, it is not going to be an easy life. It will be a life of suffering, and many times the enemy, Satan or the devil, brings on mental struggles as part of the curse that we have to experience on earth. So spiritually, that could lead into loss, feeling lost, having no meaning, no hope, no peace, no joy. And those who feel so depressed, they don't want to live anymore, they're actually the most honest ones. Like, what's the point? If they don't have that relationship with God, it's very difficult, almost impossible. Actually, it is impossible to find that deep, true meaning of why we exist on earth.
What are symptoms of depression?
So there is a list of criteria that we always have to review in order to diagnose clinical depression. There are 9 major symptoms, and I'll name as many as I can right now. But of course, the first one is always if the person is experiencing deep, constant feelings of sadness, feeling down, always like blue, that feeling of feeling blue, irritable. That's the first of the 9. Another important one is a fancy word called anhedonia, which means not enjoying things that they used to enjoy. For example, let's say a child used to really enjoy doing puzzles, but they don't care for it. It doesn't bring them joy anymore. Being isolative, used to enjoy being around others and having fun, but not wanting to go to parties anymore, not wanting to eat lunch with the other kids. Sometimes there's an interesting symptom of feeling guilty, as if it's their fault for being this way, or it's their fault for the problems of their family, or even of the world. It becomes very erroneous. Other physical symptoms can happen, such as appetite changes, not feeling hungry at all, or sometimes eating way too much than usual, sleep difficulties, unable to fall asleep, or oversleeping, or waking up in the middle of the night for no reason and not being able to fall back asleep. Energy issues, meaning feeling too tired, fatigued, and poor concentration. They were an average or above average student, and now they can't even concentrate at all, and then they're failing out. And lastly, very importantly, is suicidal ideations. Ideation means ideas, or thinking about death, or not wanting to live anymore, not caring if I get hit by a car, not caring if my nutrition is that bad, and whatever, if I get sick, I get sick. and sometimes feeling actively suicidal, which means planning and having ideas how to really hurt themselves and get killed. And this is very scary because even young children can think of how to do it, and they do succeed. For example, they know if they cross that train tracks when a train is coming that they would get killed, they can try it. Or jumping off from a height, and they know that that would kill them. Or ingesting a whole bottle of medicine tablets. Things like this. We have to be aware of these symptoms, and if there are any suspicion of any of these, we can question. We don't have to go up to the child and say, are you feeling this way? How about this? How about that? I mean, that's going to look kind of funny, but we can gently inquire. Lately, have you been feeling this way? How come you're not eating as much as before? Oh, I notice you're so tired. What's going on? And then inquiring, but if it's very difficult to figure it out, then it's okay to get professional help for someone else to ask those questions.
Can depression be healed?
This is a good question. I get this question all the time. As a Christian, as a believer in Jesus, I would say yes. For those who God will pour his grace for complete healing, I don't know exactly who that will be. So what I usually respond is, until God reveals that to you, I'm going to say everyone can be treated. Depression can improve to the point where their function can come back and their potential can be reached. True healing, I guess in my definition, would be where you don't need any treatment and you're fully healed. But I usually try to help someone not focus on that as the end goal. I help somebody to get treatment, regain their function, to be able to keep going in the path of reaching their potential in life. And when that time comes where they don't need treatment anymore, let God be the one to answer that, and maybe even respect the expert of when that might be, and not decide that on your own.
What are typical treatments?
Number one is to ensure the safety of the child or teen who is feeling depressed, because we know suicidal ideations is one of those serious symptoms. So we have to make sure that it doesn't get there, and if it does get to that level, to ensure the safety, removing items away that can be harmful, for example, guns or access to knives and razors, or even ropes, and other harmful tools that could, or even lock up the medicine cabinet, lock up all of the liquids, cleaning liquids, because those can be very lethal. But the other types of treatment, again, is to approach the biopsychosocial spiritual model. For example, for depression and anxiety, I always, even though I'm the one prescribing medications in my clinic, I always say the number one treatment is to try counseling. The fancy word that we use is psychotherapy. Because in psychotherapy, the professional clinician will engage with the child and have a discussion to talk about what they've been going through, going down to their level and having a talk, interviewing them, sometimes through play therapy, using a house model or puppets, or even what we call sand tray. There are toys on the sand, and to expressing what they're feeling through an inanimate object. So when the therapist meets them where they're at, it's kind of like a window to what they're thinking and they're feeling, to figure out what's going on. Sometimes through that, the therapist will learn there are a lot of problems in the home causing that. And so then the next step would be family therapy and bringing in the parents of how to provide parenting training and parenting tips. Now, if a biological issue occurs, then the medical professional, such as myself or a nurse practitioner, would need to address those matters. And if medication is needed, then medication is needed, right? No big deal there. And of course, not last but not least, I'm always presenting, we need to present the spiritual approach to make sure that if they have not met their Creator and their Heavenly Father, that there is an opportunity. And if the time is not right, we have to find that timing of when to introduce Jesus to them and how He can intervene in the improvement of their depression.
What can parents or teachers do if they notice a child with depression?
One thing is, do not ignore what you're seeing. If you're having a hunch or suspicion something's not right emotionally because it's happening day after day, week after week, month after month, don't ignore and hope that it will just go away. Some parents sometimes think, well, when they become an adult, they'll grow out of it. And that is not the case for many children and teens experiencing serious depression. Secondly, it is okay to ask, directly or indirectly, how they feel. For you, you will know if the child can be asked directly. For example, are you feeling depressed or very, very sad, more than normal? Or indirectly, you can ask, I noticed that you're not feeling your normal self or as happy and satisfied as usual. Are you feeling a little off lately? Do you feel a little like it's cloudy in your life? These are indirect questions that you can ask. Next is to reassure. If they start sharing their emotions, to reassure them that their sadness and what they're going through is not their fault or a wrongdoing to feel that way. But to reassure them, hey, there could be an explanation. How about we explore together what might be causing this? And there is help if we need to get help. If I can't help you, I'm going to help you find help. And lastly, if it's very serious and it's persisting, to try to fix it on your own and look up on Google and the internet for help tips. It's just easier and probably more efficient and safe to ask for professional evaluation. And just because you go to a doctor or a psychologist does not mean you have to take that medication right away. It's for an evaluation and to see if it's serious enough, or maybe it's a simple answer. Maybe their thyroid was off. It was a medical issue and you could help catch things like